So we're here today at the 5th Annual Glaucoma Patient Summit in Long Beach, California. Joining me is
Joy Glen, Chief Sales and Marketing Officer for EyeCBetter.
And I'm Joel Solano, eye doctor, glaucoma specialist, and founder of EyeCBetter.
Thank you guys for joining me today. Can you tell me a little bit about EyeCBetter and how it aims to improve glaucoma treatment for patients?
We are so thrilled to introduce our glaucoma management app, which really is designed to keep that patient finding joy in their lives, really being empowered with their glaucoma journey so that they're an active participant in that journey, and really making sure that they're connected in between those visits with their eye care provider.
Yeah, that's exactly right. We spend 99.9% of our lives outside of the physician's office, and that's one of the difficulties that we have as physicians is I don't have enough time to spend with those patients, so we've created a platform that allows us to bridge that big gap that we have in medicine.
I know that you practice yourself. Was that behind the inspiration of the platform?
Yeah, it was. So it started really during the pandemic. We've always known as ophthalmologists that we're dealing with a disease that's blinding, and really the main treatable risk factor is eye pressure, and yet there isn't an easy, safe, user-friendly way for people to check their pressures themselves at home. So when the pandemic hit, patients weren't able to come to see us as physicians, and so all of us were very concerned that patients were actively losing vision. So that's really when we decided, we've got to do something and make the way that we approach this disease better. So that's where we started our efforts towards finding a way that people could measure their pressure safely at home, and then that sort of spiraled into, there's a lot of things that we're not doing as well as we really could be doing in glaucoma. So not only did we start developing this tonometer where people can safely measure their pressures at home without even touching their eyes, but also developing this platform where we can support patients with education, patient care coordination, support groups, medication adherence, all the things that people struggle with.
Really, it's for us, it's about the whole patient and about looking at them as a whole person, not just somebody who has a disease.
Can you discuss the role of EyeCBetter in facilitating communication and collaboration between glaucoma patients and their healthcare providers?
Yeah, so that's one of the things that we really worried about, was we didn't want physicians to think that the service we're providing is cutting them out of their patient-doctor relationship. So we act as an ancillary service. So a physician, when they identify a patient that they feel would benefit from what we're doing, the care coordination and the medication adherence, what they do is to prescribe our program to their patient. And so we act, again, as an ancillary service to provide that care, but then we're doing it in conjunction with their physician. So all the care that we deliver, we package it into a month-end care report and give that back to their doctor. So we're there just to support and help the physician deliver the care to their patients.
The doctor's really driving the care plan, but we're doing all the work that's happening between those clinic visits. So you're saying, what, 50, 60, 70 patients in a day?
Yeah, it gets busy.
We're providing all that, the care, the opportunity to really listen to your patients and during the day to make sure, are they taking their eye drops? How are they living with their glaucoma? How is it impacting their mental health? All those things that you as a physician normally wouldn't have time to do, that's the work that we do. But the best part about it is that we're that bridge between the doctor and their patient. We're in the middle, and we're providing all that care that patients deserve every day.
Yeah, I'm still seeing patients, and that's one of the big issues we have with our healthcare system in the U.S. is that there's far too many patients for not enough doctors, and that ratio continues to worsen. So when I'm seeing a patient in the office, I just have a handful of minutes to spend with them, and so that's what we've done as a company, is to provide not just technology to support patients, but we use humans as well to bridge again the patient to their physician, so that we can do all the things the doctor wants to do, just doesn't have the time to do, like education, care coordination, help with how they're living with their disease.
I like that you mentioned humans behind the platform. Can you tell us a little bit about some of the humans behind the platform,
Yes.
like maybe their specialties or?
Yeah, so we've always felt that technology is the way that we can leverage healthcare, but we don't feel that technology itself is a great way to deliver healthcare. We feel that you still need humans, to have that empathy, to have that connection with patients. So we actually have a team of patient care coordinators, and we consider that to be the unit that delivers the healthcare, but we use technology so that we can scale that healthcare delivery and deliver more of it.
Our care coordinators are specifically trained to really know how to connect care, find resources that exist that maybe that patient didn't think of, or maybe the doctor isn't even aware of, and not always the ones that cost money. They know about the free options, just different ways to really take care of the whole patient, and it's being received really well.
It is, yeah.
What features can you highlight that enhance patient care support?
Well, I think I'll say for me it was really profound getting to see people that are newly diagnosed with glaucoma, because that's a really, it's a big psychological blow to find out that you have glaucoma. So especially for a busy ophthalmologist that are seeing so many patients, you probably you've got an hour of questions when you find out you have glaucoma. How is this going to impact me? What do I do? What does this mean for the rest of my life? Am I going to go blind? And there's only so many minutes in a day that the doctor has time to spend with that patient. So for me, I love that we're there to really help people that are new to glaucoma, to hold their hand, to make sure that that they have facts, and that fear, that doesn't have to be there, and that we can participate in that journey between the doctor and the patient.
Yeah. The key to glaucoma is to maintain your eye pressures at whatever that target pressure is that your physician sets for you, but to keep them there over the long run. And so, there's a couple of key ingredients to get those goals met. And one of the big ones is education. So if I see a new patient in my office, I just simply don't have an hour to explain how glaucoma works, the importance of doing the drops, the importance of maintaining those pressures. But that's where what we've created as a company is that support system, that support network, so that the physician can make the diagnosis and move on to the next patient, because they don't have time to do what we're doing. We act as almost like an extra right hand for the physician to deliver that critical step, so that patients understand how important it is to stay with their therapies.
And if I could add, I would say one thing that's really important to us is the voice of the person with glaucoma. So on our core team, everything that we do, build, design, we have people on our team that are either blind or have low vision and have glaucoma, and they're really driving all the different care resources that we're building into our program.
Yeah, that's a great point. One of the things that we value is not just delivering healthcare in a better way and trying to get people to have a better quality of life with their disease, but also on our end, from a business standpoint, it's to be able to employ people that have visual disabilities. So that's one of our initiatives is we're trying to get as close to 100% of our team to be visually disabled. Obviously, we can't get to 100%, but that's certainly our goal and our desire, and we do have some really critical team members that are helping us with that initiative. So again, that's sort of on our business end of things, not so much on the patient care delivery. But at the same time, I think having people that have visual disabilities be on our healthcare team, talking to the patients makes the patients feel like, okay, we get it, we understand what you're struggling with, and together let's get through this thing. Yeah.
I think my favorite quote I've heard, someone with glaucoma that is on our team said, "I just really want to be seen and I want to be heard," and that's what we're aiming to do, is to see and hear all the things that are involved with living with glaucoma.
Yeah. Yeah.
Can you share insights into the user experience of EyeCBetter? How intuitive of a platform is it for glaucoma patients?
Sure. Yeah, so one of the mottos that we had is we wanted it to be similar to the experience that people have with Apple. So you have an iPhone, you go to buy a new one, it's an easy transition. You open up the box, it tells you exactly what to do. So we want to model that way of doing things where we're very user friendly. If there's two ways to do things, we make it very clear so that patients know how the system works. And right down to the day the patient gets referred into our program, our patient care coordinator team calls the patient and walks them through, you got to go to the settings, download from the App Store, get the app on there. here's your password, here's your code, and they're doing all this in real time on the phone, so that we know for sure the software is working the way that we want it to be working.
So it's one thing, we're really the technology, but the human side of things. So, for example, every day someone has to take drops. So our app will put reminders out, hey, it's time to take your drops in the morning. Did you take your drops? The person with glaucoma has to be engaged and to log, yes, I did take my drops. If they forgot or they didn't do that, of course, we have our technology, we'll give them nudges. You forgot to take your drops, it's time to take your drops. But if it's been a couple days and that is a pattern, then that's when our care coordinators get involved, and they just make it super easy.
If you're a patient and you're told, look, how you're doing on your medication adherence, all of that gets bundled and returned to your physician for a month-end care report. Well, now you start to feel like, boy, I don't want to disappoint my physician. I also care about my vision, but now there's multiple factors that go into getting people, to drive them towards doing good things for their health.
Yeah, accountability works.
Accountability.
Yes,
Yeah,
yes.
exactly.
How does your participation as an exhibitor fit into your overall marketing strategy?
Oh, I think you were going to look at me for that one. Yes. I think for us, it's just about getting the word out about who we are, what our mission is, what is our why. Our why is we want to prevent blindness, and we want to really empower people that have glaucoma to live their very best life. There is no cure right now for glaucoma. It's something you're on a treatment journey for the rest of your life, and we're really just so honored to be here exhibiting and to be able to tell people what we're doing. We're a young company, so really being an exhibitor here is invaluable to us.
It's exciting to be here. There's other specialties that are doing what we've done. We're the first ones, as far as we know, doing this in ophthalmology. But the endocrinologists, for example, they do a great job with remote care, being able to measure sugars at home. That same thing, to a large extent, just doesn't exist in ophthalmology. So just being here, being able to talk to patients, share what we're doing, we're trying to let people, enjoy a good quality of life, and so it starts with telling people that we're here.
It's been a pleasure talking to you both. Thank you so much for being part of the summit.